Good morning, my friends. This is Marcella, the vegan nurse practitioner, talking to you. I know it's been a couple of weeks and I apologize for that. I have found that when I'm at home, I'm usually pretty messy. I'm doing things or I'm just laying around. And I think, well, I don't want to shoot a real quick video with me looking so yucky, so I end up postponing it. So I decided this morning, I woke up and I thought, you know what, I've just got to get on that camera, and if I have days that I look kind of yucky, just forgive me. Alright, this little short video is going to be a short one, and it's going to be under nurse practitioner because we're going to talk about health. We're going to talk about the big news right now, which is Ebola, the big scare. I want to really kind of reassure people because I've been seeing patients coming in that are quite frightened about this Ebola. In fact, we've had a couple of people come in going, I've been sniffling and sneezing. Have I got Ebola? It's like, no, no, you don't. It's only, 3 people in the United States has had Ebola, and there's 34 million people in the United States. That's 34 million. We need to be worrying about other things, but except for Ebola. Now, it is true that it is a very dangerous virus. In fact, the World Health Organization says that if you contract it, you have a 90% chance of dying from it. It is a very bad virus. It's got a 21-day incubation period. It is and can be deadly, but it only passes through bodily fluids. So unless you've handled somebody's urine, their stool, their blood, their vaginal secretions, their semen, their anything dripping or oozing from them, you're fine. Don't worry about it. I think they're kind of wondering, well, maybe it could be respiratory, but for right now, they're saying it is all contact. So it's something you've contacted with somebody. You've handled their stool or their urine or something like this. And the only people who've gotten it is, one guy who came from West Africa. He was the one who died. We have was it a doctor and a nurse? Actually, there's been about 4 or 5 people, but that is such a small amount. And it's all healthcare workers dealing with patients of Ebola, or that one Ebola patient that we did have. Now, there's been a couple of scares. Some guy who worked on, I don't know if it was a mercy ship or something, outside the coast of Africa, got sick, but he was dealing mainly with patients with typhoid. But immediately thought, well, it may be Ebola. That was up in Kansas City, and they immediately put him on precautions. Everybody's getting on their toes on those precautions now, and he ended up being negative. Everybody's just scared to death of it. And I tell you what, there is so many things in the United States for us to be afraid of. The upcoming flu, colds, pneumonia, the food we eat that's killing a lot of people, the heart disease that you get from eating foods with saturated fat, the cancers, all that kind of stuff that is going to nail your coffin shut. It's probably not going to be Ebola. Although everybody's getting the run for their money on funds and money from this disaster. Do you remember we didn't have Ebola, but Africa went through quite a big surge of it here about a decade ago, and we all felt bad. We watched it on the news, and people went over, volunteered to help them, and help them, and all this kind of stuff. And it sort of died down because once the people with it die, and you stop contacting the people that have it, then it kind of dies off for a while, and that's what it did. Now suddenly it comes back like it did 10 years ago, and suddenly we have the big fear. Now there's been 1 or 2 slips on this, but why is it so dynamic in the news when we have people dying every second of foodborne illnesses, of all this stuff that I was talking about, high cholesterol, all those things. We're so focused on these, just a couple of people. Now, Ebola is scary. I mean, you get it, and good chance is that you'll die. But how about let's work on you not getting it, not worrying about that you can get it. Kind of stay away from West Africa for a while till it gets contained again, and stop worrying about it. Well, then, after it comes out, I'm thinking these things, suddenly, Big Pharma comes up. Hey, guess what? We have an Ebola vaccine already in the works. We've been working on this, and, we need to do human studies now, but, since we would like to do them right now, but we can't because we have to wait for the FDA, it's going to be 6 months or a year. Well, boom, FDA with this big scare says, oh no, you guys can go ahead and start on your human trials. So they're already injecting this shit into people. And trials that have not been fully tested. They're doing it 6 months or a year in advance. So these people are getting it out of the fear of just 5 people who've gotten it here in the United States. This fear that's all over the media, everything, that I think is really kind of on the drummed up side, is going to be putting a lot of money in Big Pharma's pocket, because now everybody's scared to death. As I said, we got people knocking on the door going, all right, okay. I'm sorry, the camera got messed up, and then it took me an hour to try to fix it, and I ended up having to get to my other things. So to keep from canceling yet another video, I went ahead, and now I'm all scuzzy and been working in the yard, and now I'm back to finish talking about Ebola. I just wanted to stress to everybody that we really don't have much to worry about right now. We may have 20, 30 years from now, or who knows, maybe West Africa will get on a plane and move over to Kansas. I don't know, which is highly unlikely. Anyway, I know that's kind of a silly thing, but we don't have that much to worry about. We just don't. And I think maybe it's drummed up scare. Now, a month ago, who would have taken an Ebola vaccine? But now everybody's going to run pounding on the door to get that Ebola vaccine. So anyway, that's just my opinion. Hey, let's hit on just a little bit of stuff here first, because I keep getting stuff sent from the CDC and things on Ebola. I am telling you, it is just like, you're just like going, come on, is it really so horrible here? I mean, it's starting to get under control in Africa. I mean, it's starting to die down, yet we're still all in this fever. But I think somebody's behind us poking us with a stick. Anyway, let me see. Talking about the pathogenesis of the of the virus. 6 days to 10 days is average for incubation period, up to 21 days. So if you haven't gotten it since you shook hands with the West African or the healthcare worker who treated him, 21 days, then you're fine. This is ridiculous. Let me see. It is kind of yucky. I mean, it'll, as I said, it comes to you through bodily fluids, through stool, urine, those sort of things. It can get into broken skin, like me. I do a lot of stuff without wearing gloves, and I'm supposed to, but I forget. But my cuticles and stuff are torn or red or inflamed or things, all the time. And I'm always putting Vaseline, which is not good for you, on it, or other things on it to try to prevent it. But I have breaks in my skin, and a lot of people will have micro breaks, like in the palms of their hand or along their fingernail bed, and they don't even know it. And all of those little breaks are sites for infection. So that is why it's so important to wear gloves if you're a nurse or a care worker. Why it is so important to wear gloves when you're drawing blood or you're emptying urine or doing anything, you've got to use universal precautions. You've got to wear gloves. And at one time, I mean, I've been a nurse for, well, I graduated when I was 19 and I'm 57 now. So heading on 40 years. And I came from the time where it was uncool to wear gloves. You know, people would, other nurses would pick on you if you wore gloves. I mean, that's kind of hard to imagine right now, but I can remember getting kind of taunted by my charge nurse because I wanted to find gloves to put on to clean up poop on a patient who had been incontinent in bed. And she's like, well, what are you? You know, are you too good to touch, you know, a person, a patient? Are you too good to clean up poop? You know, of course, we all gag now because we're really well trained not to do something like that. But back then, you weren't. When you're washing your hands off, cleaning poop and stuff, you had poop on your hands that you're, you know, washing off and stuff. It was kind of a weird time. It was so acceptable, but it was never acceptable to me, and I don't know why. I think I'm just kind of keyed into those sort of things. But back to the subject. Let me see. Anyway, the virus gets in through that initial little infection side or breaking skin, mucous membranes in your mouth, your nose, and that goes along with, let's jump to flu real quick. Wash your hands a lot. Don't be touching your face. Don't be putting your finger in your mouth. I chew a little bit. Don't do that because you get the virus on there, it goes straight into your mucous membranes, and boom, you've got the virus. So, especially just being out there, you know, everybody's going to go Christmas shopping pretty soon. I can't stand it. I'll do Amazon. But you know, there's lots of stuff out there. You've just got to wash your hands. Don't touch your face. Don't do stupid things. You know, don't go fly over to West Africa. You know, we have to ask all our patients if they've done any recent travel lately. And to me, that's kind of like, okay, you know, I guess there are stupid people who come from West Africa and come in saying, you know, well, I'm feeling kind of a cold or flu coming on, which is even weirder. Let's get on. Is the symptoms are so close to other viruses that it's very confusing for people. Anyway, the virus migrates into the liver, the spleen, adrenal glands, the lymphocytes, which is part of our immune system, undergo apoptosis. I always pronounce it wrong, which is cell suicide. Every cell in your body is genetically programmed to die in less than 100 days. You know, some are 60, some are 90, but at that 60-day mark, a little switch flips and they die. You know, they commit suicide, which is good because we don't want any cells around beyond their time. And then another one is produced, and we go on and on. In fact, we totally change every, 3 months. We are a whole new person. Our skin is new. Everything's new. Of course, it's multiplying off of the guy who was last, so you're still going to have the scar and everything. Let me see. They've now got 2 vaccines that have potential, and they are jumping over the safety regs and stuff to get that on board and start those human trials, and they've already started them. And I think that's awful that they didn't wait, and still it's going to be, a year before we see those vaccines. But now everything's been stirred enough to where people are going to pay that money and get those vaccines. So, this is a huge money maker for them. And since they're not really tested that well, to me the safety is not, I bet you there'll be a lot more injuries and things going on, giving this to the masses, because you always have reactions and things to everybody when you give, anything to millions of people. So how much is this going to weigh against the 5 people that contracted it from a guy who came back from West Africa in the heat of it? I don't know. Anyway, that's just my opinion. Don't. What was I going to tell you, though? I wanted to say something. I might have to cut all this dead time out. Oh, but now they're talking about, well, maybe, you know, fruit bats carry things, so maybe fruit bats can be a cause. Maybe they can infect people. And here they have forest antelopes, possibly porcupines. It's like, are you trying to have everybody do like these mass murdering of these animals? You know, people are freaking nuts. You know, we got lots of crazy hunters and rednecks out there that'll go and blast away every, you know, bat that they see, thinking, ooh, Ebola. You know, there is absolutely, in fact, I read an article earlier today that said there's absolutely no proof that bats or antelope or porcupines or anything other than primates and humans can pass on and transmit this disease. That's disgusting. Symptoms. All right, symptoms. Now listen to this. Fever, fatigue, muscle pain, headache, and sore throat. What does that sound like? It sounds like just about anything we have here. A cold and flu. We had somebody coming in sniffling, thinking he had Ebola. Anyway, followed by vomiting, diarrhea, get a rash, symptoms of impaired kidney and liver function. Impaired liver function, you know, your skin's going to turn a little yellow. Impaired kidney function might show up in darker colored urine. You know, you're drinking your water, yet your urine is getting concentrated, maybe even a brown color, maybe even none. You know, that's definitely a kidney dysfunction there. Suddenly you're edematous and swollen when you aren't normally. Let me see, both internal and external, bleeding, oozing from the gums, blood in the stools. But see, that could be so many things. Laboratory findings include a low white blood cell count, and remember why that would be is because the virus attacks white lymphocytes, you know, that are part of your immune system, which are white blood cells, and kills them. They turn on their suicide switch and kills them. So in a way, I guess, well, no, it isn't really similar to HIV. Somebody did compare it to that, and it's like, no, because HIV is a totally different pathogen, but it messes up the white blood cells, but not actually another cell of the body, T cells, but let me not go too far away. Okay, anyway, so, you know, your chances of getting this are so slim. So please, all I want you to do is relax. Don't worry about it. If things do ever progress to that, it's going to be, you got to know that Big Pharma is going to have plenty of vaccines available for us. And by now, the scare has caused a lot of the major hospitals to build up all these policies now and procedures on how to deal with somebody who comes in with Ebola and actually any other thing, typhoid or whatever that might come through the door. So it's actually improved our health care better because of this scare. But what is bad is scary fear in people. Fear causes people to do things that are dysfunctional, that are not right, that are scary, that aren't good. And to me, that's the worst part of this whole thing, is the fear that it's drumming up. All right, okay, listen, I'm going to let you guys go, and I'm sorry again that it's taken me so long. Please write down any notes down below that you might want me to do. I'm trying to shorten these, but I bet you this is already going to be 15-20 minutes because I just yammer too much. That's about it. Please hit like if you liked it. Tell your friends to subscribe if you came across this. And I'll see you guys soon. Talk to you later. Bye-bye.